Now, you've talked about not having too much salt and how that is related to goiter.
Yeah.
And actually growing up, and also like in med school, there's an element of it in relation to goiters and, the thyroid gland not working as it should.
Yeah.
But what's the story there? We know it's not salt directly.
Yeah.
What's the story there? Maybe so that they can understand.
Yeah, so the story is iodine.
And what's your thought on, I know when you have patients who have hypertension and just some chronic conditions, you're told cut off salt completely.
Yeah.
Yes or no?
So we do not recommend completely cut off. Yeah. So we recommend minimal salt because we know that salt is still important, especially the iodine in the salt. So we don't tell you take no salt. We probably will tell you maybe take other types of salt, like the pink Himalayan, the sea salt.
Do they actually have iodine?
Some have.
Okay.
Some have. Or they should. Actually, all salt now should. Or take very minimal salt, especially cooked salt. Don't add uncooked salt in your food.
Okay.
Yeah.
I'm learning. I'm that person. And
Yeah.
people normally tell me, you haven't even tasted the food. I'm there.
Adding
No, I know it
salt.
needs salt. But that's something I'm really working on.
Yes.
Yeah. Hi guys, welcome back to A Dose of Health, the podcast where I give you not too little, not too much, but just enough information to help you make an informed decision. Welcome back. My name is Dr. Hope Simiyu, and we have another guest. She's been here before, and there are 2 episodes that will go out back to back. So if you've watched the first one, you know who's here, but I'll let her introduce herself one more time. But before we do that, let me just give you a minute to subscribe. So please press that subscribe button. Please follow us on our socials. We'll put our handles down here so that you can just follow us, engage with us, and subscribe. So, hi Doc.
Hi.
Welcome back.
Thank you.
Introduce yourself.
My name is Dr. Caroline Mithi. I am a consultant physician and endocrinologist, meaning I deal with all the hormones in the body.
Okay. So now for the previous episode, I asked you all the questions I needed to ask you about the doctor's seat and a journey to Inside Out.
Yeah.
So I want to ask you a random question. If you are president for a day, what would you do or what would you change?
I will give or offer free access to basic education. That includes, all the way from primary, secondary, and university. And that is because education is a great equalizer. That is actually what I'd do.
Okay.
Yeah.
So taking us back to the Kibaki era.
Yes.
And yeah, those were good times,
They
by the
were
way.
good times. I mean, some of us studied during those times.
Yeah. And yeah, it's true. It's a great equalizer.
It is a great equalizer.
Yeah.
There are people who would never step in the university if they're forced to pay the money that currently people are paying to actually have access to university education.
Yeah. I usually say 2 pillars of a functioning government are your education sector and health.
Health, for sure.
So I don't know where we are, but it's not looking good.
It isn't.
It's not looking good.
Yeah.
Okay.
Let's hope things change.
Yeah. But we are the change. You know that.
We are the change. Do you have a voter's card?
Yes, I do.
Good.
And if there's anyone here in the room who doesn't have a voter's card, I'm looking at you. They know themselves.
Yes.
I'm looking at you. Please be ready to get one.
Yes.
Thank you. Before the deadline, if there's going to be one. All right. Now, you said you're an endocrinologist.
Yes.
For someone who maybe has not gone through the previous episode, what does that mean?
So endocrinology is the study of hormones. We have more than 50 hormones in the body, and hormones are just small chemical signals that tell other parts of the body how to function. And most of these hormones come from the brain, and then they go to other functions on the body and tell it function like this, don't function like this, helps with our metabolism, helps with our weight, helps with our fertility, ovulation. So basically, they're those small hormones that make the body run.
Okay. What are like the top 5 ones that we should all be aware of?
One is the thyroid hormone.
Okay.
And I'm happy we're talking about that. And that's because it affects every single place in our body.
Okay.
2 is the cortisol hormone. Okay. And this cortisol affects weight, affects stress, affects sleep. 3 is our reproductive hormones, of course.
Yeah.
So estrogen for females, testosterone for males. And then we have insulin hormone, which affects diabetes or causes diabetes. And also my other favorite hormone are the hunger hormones and, fullness hormones. So we call them ghrelin, leptin. So we have a lot of hormones, and all of them influence how the body functions.
That's true.
Yeah.
So you mentioned the first one, thyroid. So we're going to talk about that today.
Yay.
And many people really don't know much about the thyroid gland. First of all, the thyroid is a gland. It's small, but it's so powerful and it's so mighty. So what are some misconceptions you've had about the thyroid and some of its functions?
So starting from where the thyroid gland is. So it sits just in front of your neck.
Yeah.
It's a very small butterfly-shaped organ. So ideally, you shouldn't see it. So once you start seeing it, what we call goiters, then we know that that thyroid is enlarged. Okay? So this gland produces hormones. Okay? And these hormones are basically just like fuel that make our body function and our body do. So some myths and misconception is, one, if you get a goiter or your thyroid enlarges, then, you didn't take much iodine, or, your casts, or just a lot of things that really go with the thyroid that are not true.
Okay. Now, question, because I know someone is sitting and they're wondering, so is the thyroid hormone the Adam's apple?
No. So the thyroid hormone actually just sits on top of the Adam's apple. Yeah, so it's a small butterfly. It's actually less than 4 centimeters, like this small. Yeah, but it has two sides, it has two lobes, and then a center, what we call the isthmus. So it has the left, the right, and the isthmus. Once you see the thyroid gland visibly or you touch it, then you know that that is enlarged. Ideally, you shouldn't see it, you shouldn't feel it.
Yeah.
Yeah.
Now, you've talked about not having too much salt and how that is related to goiter.
Yeah.
And actually growing up and also like in med school, there's an element of it in relation to goiters and, the thyroid gland not working as it should.
Yeah.
But what's the story there? We know it's not salt directly.
Yeah.
What's the story there? Maybe so that they can understand.
Yeah, so the story is iodine. Yeah, so you need iodine to make thyroid hormone, or rather to cause the conversion. So normally the thyroid gland gets a signal from the brain. Okay, so a small part of the brain called the pituitary gives a hormone called the thyroid stimulating hormone. So it tells the thyroid, hey, give us thyroid hormone, which is like fuel in our body. But this thyroid hormone is produced as T4 or tetradiiodine. Okay, so T4, the conversion to the active form, which is T3, needs iodine to take place. So that's where iodine comes about.
Yeah.
So if you do not have iodine in our body, then you're not producing T3 or the thyroid hormone, and so the gland just becomes big to try and overcompensate. And so there was a directive: all our salt needs to be iodinated or iodinized, just to prevent all these goiters. And so we don't see much of that unless not there's something else underlying.
Yeah. And what's your thought on, I know when you have patients who have hypertension and just some chronic conditions, you're told cut off salt completely. Yes or no?
So we do not recommend completely cut off. So we recommend minimal salt, because we know that salt is still important, especially the iodine in the salt. So we don't tell you take no salt. We probably will tell you maybe take other types of salt, like the pink Himalayan or the sea salt.
Do they actually have iodine?
Some have.
Okay.
Some have, or they should. Actually, all salt now should. Or take very minimal salt, especially cooked salt. Don't add uncooked salt in your food.
Okay.
Yeah.
I'm learning. I'm that person. And
Yeah.
people normally tell me, you haven't even tasted the food. I'm there.
Adding
No, I know it
salt.
needs salt, but that's something I'm really working on.
Yes.
Yeah. Okay, so now why I wanted us to talk about the thyroid is because, so I have a friend who was really, for many years, was noticing they're gaining a lot of weight. And I know we've talked about weight loss, so that's not like the direct topic, but she was trying to lose weight, but at the same time, she's gaining so much weight and it's becoming so hard for her to lose weight. And she kept on wondering, I'm doing everything right, and the weight is not going. Then one day she went for her annual checkup, of which we recommend, guys, by the way, please make sure you get at least one annual checkup, just so that we can see if everything is okay. So she went for her annual checkup and she was told that her thyroid hormones are low. So she had hypothyroidism, and that was what was making her not lose weight, because one of the symptoms is weight gain. So I just wanted us to talk a bit about that, and especially for women, because we know the thyroid and a woman, very important. So what are some of the things that you see, especially in relation to the thyroid, maybe symptom wise or symptom wise?
Okay. So symptoms are based on either low production of the thyroid hormone or high production of the thyroid hormone. So we start with low production, where your thyroid is not producing enough, and what we call hypothyroidism. So hypothyroidism, remember, thyroid hormone is like fuel in our body, so everything slows down, meaning your metabolism slows down. So you'll tend to have weight gain and difficulty to lose. It affects fertility and difficulty in conception. So you'll find either your menses disappear or you're receiving very intermittent, irregular menses. The other thing conjoined with that is difficulty in conception. So anyone who's into the fertility journey, we always recommend have your thyroid checked. The other thing, it can cause leg swelling, it can cause hair loss, it can cause, just constipation. You're always constipated, decreased bowel movements. The other thing is fatigue, just unexplained fatigue, and depression. Yes, can be a sign of thyroid hormone. So imagine head to toe, it's affecting every single part of your body. The heart rate can go slow, can go down. So that's hypothyroidism, some of the symptoms. Hyperthyroidism on the other end, meaning that now your thyroid gland is producing excess hormones, your body is on an overdrive. You have fuel, so you'll have sweaty palms, you're anxious, you're irritable, you're losing weight because now your metabolism is very fast, even what we call unintentional weight loss. You're not doing anything to lose the weight. And now you can have excessive menses all of a sudden. You can have just fatigue because also your metabolism is also super high. The other thing is palpitations, like how you're aware of your heart beating. Sometimes they say, I can hear my heart through my ears. So that's a sign because everything is on an overdrive.
That's so interesting. You've talked about unintended or unintentional weight loss.
Yeah.
Let me tell you, when people are there talking about how it's so hard to lose weight, me, I'm just like, guys, for me, it's so easy. I think I can gain weight today, let's say 1 kg. I can literally breathe out and lose that weight.
Oh, lucky you.
Yeah, so you say lucky me, but I've been struggling. Okay, previously, I'm in therapy, guys, don't worry. Previously, I used to struggle so much to gain weight. I would eat. But eating is exhausting. I'd do a lot. And then I'm not gaining the weight. But then losing weight.
Like this?
Yeah, just like that. So I used to find it so interesting how we have different struggles. And I'm just like, can we just exchange? Or not exchange. You, when you're losing, give me. Like, Yeah. So at some point, I was like, maybe actually I have a high metabolic rate. Maybe hypothyroidism. But I don't... It was negative for me. My body is just small.
Yeah. Lucky.
Yeah, but we were talking before and you were telling me about a patient you saw. And I just want you to explain just how the symptoms can manifest. And because they're so similar, they kind of feel like symptoms of PMS, symptoms of like other things. Sometimes it's just your thyroid. So maybe you can tell them about that patient that you saw.
Right. So, I'm an obesity specialist also. So I deal with a lot of obesity and overweight. And so... this patient who was 180 kgs and, had been to several doctors, has had, therapy, GLP-1s, but the scale is not moving.
Oh, she was also on GLP-1s?
Yes, but the scale is not moving. And so part of the panel that we do when you come in is actually check your thyroid, okay? And so we found like she had a severely low thyroid, and so she had hypothyroidism. And when we started the thyroid replacement, which is a tablet really that you just take once a day, her weight started losing. And she'd lose like almost 5 kgs, 6 kgs in a week without actually needing to up her GLP-1 dose. And so we call the thyroid hormone the hidden disease or thyroid disease, just because it doesn't manifest in any particular disease. It's just, feeling tired, lethargy, depressed, weight gain. So just non-specific symptoms. So you actively have to look for it. And everyone needs to have at least, if you've never had, at least go and ask for a TSH. That's just a screening test for the thyroid. And it won't cost you, more than 1,000 shillings to do.
Well, depending on where you go. In some places, it can be more, but I think I'll put TSH here just so that they can understand it in full.
Right.
Yeah. What about the one with the mood changes?
Yes. So, someone who's just irritable and anxious, and most of these alternate between depression and irritability and anxiety. And so, out of nowhere, and you just can't control. And so, we checked her thyroid and she had hyperthyroidism. And, just emotion, we call it emotional lability, where one time you're anxious, the other time you're depressed, the other time you're very happy. So there's just, you're not sure where this person is. Check your thyroid.
Okay. Now you say that, and I don't know, are you like on social media like that? You're deep inside?
I am
You're like
inside.
me. You know me, I'm lost there.
I am.
I need
Yes,
someone to come and do this.
I try.
So I think I don't see it as much these days,
Yeah.
but there used to be this trend of iron deficient girls stand up or like self-diagnosis. And now that you've just mentioned that just excess fatigue can present, and it can be so many other things, vitamin D, it can be your thyroid, it can be your iron. So what are some of the missed opportunities you see, especially with patients? Yeah.
With regard to thyroid disease?
Yeah. And maybe not weight. I think
Yeah.
we've done weight.
Yeah.
Yeah.
So non-specific symptoms, like for example, you come in with leg swelling.
Okay.
And we check your kidneys, everything, and tell you you're fine. But really check your thyroid, because most patients with hypothyroidism will have leg swelling that really darkens.
Okay.
And then if you just start darkening your skin, then check your thyroid hormone.
Okay.
So some missed opportunities is, and now we're talking about patient-led consultations, in
What
the
does
sense
that
that
mean?
you go in as a patient and ask, I want to have a thyroid check. Now, it's no longer wait for the doctor. And that's why empowerment is really important. And
Yeah.
we really encourage that.
Okay.
And to go and say, you know what, I've just been feeling a type of way. Can I have my thyroid checked? And I'd be like, yeah, perfect.
Okay.
Yeah. So the missed opportunities is, one, as doctors, we have to be aware that now we're seeing more thyroid disease than previously there for just some reason. Yeah. Either because we're diagnosing it more.
Yeah, actually.
But also as patients, then you need to say that once you hit a certain age, and you can even call it 25, then have your thyroid checked. At least as children, when you're born, one of the tests we need to do is thyroid.
Yeah. Do we do it here? I don't remember having the baby screen.
So we screen. Now the recommendation is to screen, because we've seen that if you have, inability to grow, or, slow growth, or you're not hitting your milestones, then your thyroid. So now the recommendation is at least do a TSH in children. That will push you up until puberty. Then at puberty, have your thyroid checked, and then maybe probably at 25.
Okay.
Yeah.
Okay.
And the downside about the thyroid is you actually have to test for it.
Yeah, there's no
no
way
other
around
manifestation for it.
Yeah, unless it's like really prominent,
Big.
like a swelling.
Yes.
Yeah. Okay, you've talked about now the children, which is very important. What about pregnant ladies? Apart from having the thyroid test during your ANC, of which I don't know if it's like part of our profile. I know globally as a standard it's there.
Yeah.
Is there anything else that we might need to look out for, especially with pregnant moms who maybe have a predisposition to getting thyroid disease?
Yeah. So if you have anyone in your family with a history of thyroid disease, especially hyperthyroidism, one of the conditions we call Graves' disease, that can predispose you to getting thyroid disease. And sometimes you just need a trigger of some sort, especially for this autoimmune thyroid.
But let's talk about that next, actually.
And so if you have anyone in your family with a history of thyroid disease, then please have the thyroid checked. But like you said, globally, it should be one of the screening tests. And it's not part of our ANC profile as yet, but then it's something. The other thing is, if you've had frequent pregnancy losses or previous pregnancy losses, because then hyperthyroidism can present with that. If you have difficulty in conception, on the other hand, hypothyroidism can present with us. If you're pregnant and we do your scans and you find your body has what you call IGR, or growth restrictions, they're not growing well, so they need thyroid hormone to grow, even the fetuses.
Yes.
And so we have to check your thyroid. So sometimes you're feeling very lethargic and you wonder, is it first trimester things? And just check your thyroid. So basically, any opportunity that you present to hospital, just go and say, can I have a TSH done? And we'll be happy to do it.
And I think it's important, just please go for your NC.
Yes.
Bare minimum.
Yes,
at least for, I think the recommendation now is 8 throughout your pregnancy, but a minimum of 4 should be at least.
Agreed.
Now you talked about autoimmune diseases. I know hyper and hypo both have them. So what does that look like?
Okay. So the common hyperthyroid autoimmune disease is called Graves' disease. So basically, your body produces antibodies that attack your thyroid gland. Okay. And so I usually give an example of, imagine you have a flu, and you don't have to take medicine for all flus, because your body produces antibodies to fight this flu. Okay. Those are like soldiers in our body. So after the flu dies off, the antibodies should die off. But then sometimes they don't. And so they find something to go and attack. and they go to the most vascular organ because the thyroid has a lot of blood supply, and so they go and attack the thyroid gland. And with that now produces excess hormones. So that's what we call autoimmune thyroiditis or Graves' disease. And so to diagnose, we say, yes, you have hyperthyroidism, but do you have these antibodies? Okay, and so we do an antibody called the TSH receptor antibody to diagnose. Hypothyroidism also has something called Hashimoto thyroiditis, which is an autoimmune. Same thing. So the antibodies go and attack and kill your thyroid cells that others should be producing the thyroid hormone. And so now you start producing very low hormones. So anyone who has hypothyroidism, we always want to do antibody tests, especially for young females, because then there's medication for it and there's treatment in a sense for it.
Okay. So apart from the test, the blood test, what does investigation look like?
So one, the thyroid test, the antibody testing, but also an ultrasound. So we just do an ultrasound to check your thyroid, even though it's not enlarged. We want to see, sometimes it enlarges inside, like, so it's called retrosternal. And then part of the things in the ultrasound we see, do you have nodules or swellings within that swelling? And especially if you come in and you're above 50 and you all of a sudden have a goiter, we worry. And so we have to check, could it be cancerous or not? And then now with that, there are times if you have a nodule or a swelling, we go in with a small needle and do something called a fine needle aspirate to actually take it to the lab. If we suspect autoimmune thyroiditis, that's Graves' disease, we usually do a scan called radiouptake scan, where we just give you a radiation scan to see how will your thyroid uptake. So it's not only, your thyroid is high, it's now what is the cause, is it antibodies, is it that it's enlarged, is it, so we have to look for that.
And for the antibody screening, is it accessible? In Kenya?
It is accessible, actually. Even in public facilities, it is actually accessible. So especially the TSH receptor antibody, that should be available in most, especially level 5 and level 6 hospitals. Accessible.
Let's give an example. Level 5?
Well, let me say level 6, at least, I know level 6 KNH and KU you'd get the antibody testing.
Okay.
Maybe level 5 I'm stretching, but I'm not sure.
But level 5 is like Mbagathi.
Yes.
Okay. Then the next question, you mentioned cancer. And why I think you brought in the aspect of a woman is it's one, thyroid cancer is more common in women. So is the landmark 50 and above, that's when we start screening, or when is it recommended that we start screening?
So if you have a family history of anyone in your family with thyroid cancer, so the screening starts as early as 25 years old. Okay. But if you do not, then at around 30, we do a TSH and see, because that's the first sign your thyroid hormone will be off. And then now at 50, we still check your thyroid hormone, and if it is off, then we have to do an ultrasound. So not everyone will get, an ultrasound. The hormone test actually tells us who to give that. But now, interestingly, like we were saying before, we found even younger girls, around 20 to 30-year-olds, having thyroid cancer. And so, the landscape is shifting. I usually say thyroid cancer is a very forgiving cancer because it's slow growing for most cancers. But then if you feel off, you notice a bit of a swelling, possibly females shouldn't have a prominent Adam's apple, but if you find out that you have, like a swelling on the throat, just go and have it checked. So,
and sometimes it's not cancer. Sometimes like there are other benign lesions, benign meaning non-cancerous. Okay. And actually, please tell them about the symptoms, or rather the emergency signs when it swells. Because remember, airway obstruction and all those signs. Please tell them.
So sometimes the thyroid gland can not only swell outwards, it can swell inside, just below this bone here. It's called the sternum. And so behind it, we have the esophagus, that's a food pipe, and the airway, that's a trachea. And so once it grows bigger, then you
Yeah.
can start pressing on the food pipe and on the windpipe.
Mm-hmm.
And so you may present with like what you call stridor, meaning you're wheezing, especially even at rest.
Yeah.
So the wheeze may not only be asthma, it can be
Yes.
something else.
Yeah.
Or you're having difficulty swallowing, especially solids. You're having difficulty in breathing, especially when sleeping. Yeah. And so that's a sign of let's check your thyroid gland. So those are emergency signs,
Yeah.
especially when you start wheezing or having the stridor, because that means your airway is closing.
Yeah.
The other thing is if you have what you call thyroiditis, meaning that
Yes.
your thyroid just releases excess hormones at once.
Yeah.
And this may present as palpitations and can actually cause you to go into heart failure because now your heart is unable to pick up. So if you have emergency, or immediate palpitations with excessive sweating, difficulty in breathing, etc., we say that we have to get yourself checked for the thyroiditis. And for that, now we actually give treatment.
Wow. That was an OSCE question, first of
Was
all.
it?
An OSCE is the exam we do at the end of the clinical years in med school, and it's the one that makes you pass or fail. Yeah, so that was a very important OSCE question.
Yeah.
Now, because we are wrapping up, I know we can't finish without talking about postpartum. So what do we tell moms about the thyroid during postpartum? What should they look out for or be aware of?
So some thyroid, especially abnormalities, if you had hyper or hypo, I'll start with hypo. So if you have hypothyroidism before your pregnancy, during your pregnancy, we always want to increase your thyroid hormone, meaning the dose that we're giving by like a factor of 1.5, because now you're not only alone, we're also giving the baby. Okay. So after the pregnancy and the baby comes out, more times than not, we go back now to your original thyroid hormone. So you will not persist with those high doses. That's one thing to note. The other thing to note is if you have hyperthyroidism, we do a change of medication. So normally we'd give you a medication called carbimazole, but once we realize you're pregnant, we stop the carbimazole and give you one called PTU or propyldiuracil. And then now after pregnancy, we go back now to carbimazole. Okay, so that means that you have to present yourself to hospital once you realize you're pregnant, and even after the pregnancy. There are people who get pregnancy-induced thyroiditis, and that mostly can go down with after the pregnancy. Okay, so after the pregnancy, we know the dose requirements go down, but also some may resolve, or some may actually be aggravated, know, and that means that you continue with the thyroiditis or hypo or hyperthyroidism. Any mom who's diagnosed with thyroid disease, your baby has to be checked for thyroid disease, especially at birth and within 6 weeks, just to make sure that we do not have any thyroid disease. It's not transmissible, or you don't transmit it, but we know that because now in the body or in the womb, they're used to thyroid hormone supplementation. We probably want to check how they're doing after.
Yeah. And actually, low thyroid hormones, especially in a baby, it predisposes them to infections. It's like an immunosuppressive state.
Yes.
Yeah, so we need to be very keen as well.
Right. And if your baby is not growing, they have low stature, it's usually a missed opportunity to actually check them for thyroid disease, and it's easily correctable. Yeah. So.
This is why your clinic visits are very, very important. I think at the end of the day, what we're trying to say is please just get it checked. Have your annual checkup first of all. If you're on medication or you're diagnosed with a condition, please follow up with your doctor. Don't treat yourself. And especially if you're pregnant, some of these conditions need extra care, and there are some medications that have to be changed for the safety of yourself and the baby as well. Yeah. Okay. I think that was it.
Yeah. Yes.
We said it's tiny, but it's a powerful organ.
It is.
Yeah. So at the end of the day, is there a parting shot for the girls, the women? Is there something you want to tell them in relation to their thyroid health?
Get your thyroid checked. Really, it's as simple as this. And not only for women and girls, even for men. Even for men. And what we realize, if you have thyroid disease, especially in men and older men, we always have to rule out cancer, because we know thyroid is common in females. So when you have a male, then we run, we actively look. And so the only way to find out about thyroid disease is actually having a check done. And present yourself and just say, I want a TSH, just that, and we'll be able to interpret that for you.
Okay. Now we are wrapping up. And I can't ask you the same questions I asked you last time. So I have to think of another interesting question. What's one thing? No, two questions. if you were to go back to, let me say, your university and you had the opportunity to choose again what you want to do, would you change your mind and not study medicine, or what would you do?
Interesting. I'd actually study medicine.
Okay.
Yeah.
Don't worry, no one is watching.
No, no.
No one is watching you. Just say the truth.
I mean, growing up,
Yeah.
I was a sickly child, so I really
Okay.
frequented the hospitals because of
Mhm.
asthma, etc. And
Yeah.
so I was in that environment. So initially I thought, oh, nurses are the it. So I knew I wanted to become a nurse.
Yeah.
And then one day my mom was like, maybe you should do medicine. I was like, okay. You know, so it was just in that environment, probably
Yeah.
something healthcare.
Mhm.
Yeah.
Okay.
Mm.
Okay.
You,
Sawa,
what
sawa.
did you want to do? Or what would you have done?
I feel like I really enjoy medicine, but I think now because it's a second chance,
Yeah.
I would actually go into veterinary medicine.
Ooh,
I really wanted to
interesting.
work for Nagio. Imagine you're just there in the wild with the cameras and you're like, oh my God, that's a rhino. Let's go
Oh,
and treat the rhino. Yeah.
interesting.
Yeah. So I think my favorite thing to watch on Instagram
Yeah.
is like when they're saving elephants or like injured elephants.
Yeah.
Oh my God.
Oh, that's
I
so
love them so
cool.
much. Yeah. So I think I
Nice.
would do that.
Yeah.
Yeah.
Interesting.
Okay. Last question. What's on your bucket list? Maybe give me top 5.
What's on my bucket list?
Yeah.
Like what I'd want to do, where I'd want to go.
What you'd want to do, what you'd want to experience, where you'd want to go.
Very interesting question. Can I say I'm living my dream?
Minus that one. Minus that one.
Like I said, I want my dream will be to create an all-inclusive wellness center.
Okay.
That
But I feel
for
like
me
you're already
is,
doing that.
I am doing that.
Yeah.
But now, just integrate everything and get people on board and just pull others up as we rise.
Okay.
Yeah. So that for me
Yeah.
is places I'd want to go. Honestly, I don't have any at the top of my mind. I think for me, my ideal is to be to see my children grow up well, to stay. So I'm a very family oriented person. So it's not about places and things.
Yeah.
It is to create such a lovely home environment for my family and for my children,
Aw.
and for them to grow up and say, "Wow, we did well."
Yeah.
Yes.
Okay.
So for me is that.
Wow. Well, for the rest of us,
What is your bucket list? What's on your bucket list?
I guess travel is there, of course.
Yeah.
What else? Honestly, I would like to climb a mountain, but I don't know who's going to do it.
Not you.
It's not looking likely, but I
Yeah.
would really like to.
You should start. I think
No, but if we could actually we can take a chopper and just meet at the top.
at the top.
Yeah.
Yeah.
But I think like just being at the top of a mountain and just looking down, I think I really want to do that.
Yeah. Just about I've done Kilimanjaro.
Have you?
I have.
How was it?
To the peak. It's actually easier than Mount Kenya.
Oh yeah, because I hear it's not as steep.
As steep.
Yeah.
So it will be a good mountain to start.
Yeah. Okay. No, it's too long. It's too maybe what's this one over here?
And long or not.
Let me start
Yeah.
there, long or not. I think something else I'd want to do. I'd want to live in a coastal town. Yes, yeah, maybe like for 1 year. I don't like humidity that much, but I
Yeah.
think like for 1 year.
Yeah, that's Mombasa, Lamu.
Yeah,
of the
something like,
sort.
and like
Yeah.
a slow one.
Yeah.
You know, where like we just wake up
Yeah.
and do whatever you want to do.
Right.
You know, I'd want to do that. What else? Why? This is telling me I need to go and formulate my bucket list properly.
Right.
Yeah, but travel is definitely up there. Yeah, I think visit every continent.
Yeah.
Maybe not Antarctica. I don't know if I'm there yet,
Yeah.
but yeah, travel is definitely up there.
Interesting. Yeah, got me thinking what is on my back. And that's
For
the
you,
thing.
like your
for,
kids
for
are
me,
but for
me.
you, think about it.
Yeah, let me think about it.
Yeah. Okay.
Yeah.
So do you want to plug yourself?
Yes.
Please do.
So we run a wellness center, which is a hospital called Evolve Well Healthcare, that we deal with everything hormone, diabetes, and other medical conditions, but especially obesity and overweight management. You can get us on our socials as Dr. Caroline Mithi on Instagram, TikTok, Facebook, and LinkedIn, and also Evolve Well Healthcare.
Okay.
Yeah.
Okay. You had it here. Now, yangu ni machache. Thank you for reaching this far. If you have, please subscribe. I'll give you a moment. the moment is done. But also please be sure to follow us on our socials as Dr. Hope Simiyu, and also A Dose of Health, the podcast, on Instagram, on TikTok. We're not on Facebook yet, but maybe we'll get there. LinkedIn as well, and wherever you listen to your podcasts. And I hope you've learned something about the thyroid and you will do something about it. So that's a wrap.
Yeah, thank you for having me.